Hey, Barto Family Chiropractic practice members. I am doing a quick video today on aerobic activity. Aerobic activity is a requirement to good health and specifically for your spinal health. So if you remember from any of our re-exams, I'm always asking you, how many days a week do you do at least 30 minutes of aerobic activity? Because what I want is for you to not be reliant on me. I want you to achieve overall health and use me only as you really need, okay? Now, what I have found is that the people who do the best with their lifestyle actually hold their adjustments better, their scans get better, and we can reduce their frequency of care, usually to like every 3 weeks, or in very rare circumstances, once a month. Because it's rare for once a month because so few people really do everything that they need to do. But what I want is for you to find what I'm always trying to do is to find a balance between what does your lifestyle look like and that balance with chiropractic care, so that we're consistently making sure that you move forward. I absolutely, without a doubt, don't want anybody's health to fall, but I always want it to be moving forward. So aerobic activity is one of those things. Now, your goal for aerobic activity is to get it in daily and to get 60 minutes in daily. Now, that doesn't have to be a one-time session of 60 minutes. You can break that up into 2 30 minutes, 4 15 minutes, just so that it ultimately adds up to 60 minutes. But if you could only just get 30 minutes in a day, you're still going to get really big benefits. So before I go on into telling you what that needs to kind of look like, I want you to know the benefits of doing this. Okay, because I know that when you fully believe that this is going to be a benefit to you, then your actions follow your beliefs. So we got to work on changing, we're not changing behaviors, we're changing beliefs, and beliefs will lead behavior modification. So the most immediate benefit from exercise is that it's going to improve your brain. I know personally that anytime I'm active, I immediately get more creative. As I'm exercising, ideas come to me. If I'm sitting around all day, I'm literally brain dead. I just nothing comes to me. I'm just like zapped. So being active increases your brain. It helps you see more possibilities and feel a lot better about yourself. So there's actually a study that shows that high levels of physical activity were associated with a 70% reduction in cognitive impairment, Alzheimer's disease, and dementia of any type. Now, to move that over into like a financial cost savings, if somebody is to develop Alzheimer's, it costs $80,000 a year to manage. That doesn't mean that it's getting better, but just to deal with somebody who has Alzheimer's costs $80,000, which is a lot of money to just manage something as awful as Alzheimer's. Now, my grandma suffers, so if you want to know like how awful that is to talk with somebody who has no freaking clue who you are, I know what that's like. Okay. So that's your most immediate impact of exercise, is that it increases your brain. Now, it is a genetic requirement to move. Without exercise, we will get sick more often. We will reduce our vitality, and it shortens your lifespan. So you will die sooner. And it's free, and you really don't need any exercise equipment for this. Okay. Other benefits of exercise is that we know that exercise, getting at least 30 minutes of aerobic activity daily, will reduce 50% of all cases of type 2 diabetes, coronary heart disease, and many cancers. And all that we need is like a moderate intensity exercise each day. So a moderate intensity exercise is walking at a 3 mile an hour pace. That's it. 3 miles an hour pace. We also know that research shows that 50% of all cases of colon cancer could be prevented by increasing physical activity. That would prevent 50,000 cases of colon cancer, and it would prevent 24,000 deaths each year. 24,000 deaths. However, with that being said, 70% of adults in the United States do not get 30 minutes of moderate physical activity 5 or more times a week. 70%. So you guys watching this, 7 out of 10 of you aren't doing this, okay? But it's really easy. 24% of Americans have no physical activity levels whatsoever. So this is easy, it's cheap, and it makes total sense why we have so much sickness in the United States. So if we can just increase our physical activity, we know that it's going to prevent cancer. And if it can prevent cancer, then it can prevent anything. So we should do it. All right. So what we're trying to do is get to our aerobic zone. And then your aerobic zone is 70 to 80% of your maximal heart rate. To come up with your maximal heart rate, what we want to do is take the number 220 minus your age, and that is your maximal heart rate. So let's get a calculator because I don't do math. 220 minus 35 is my age, and so 185. If I can get my heart to beat, well, at 85, that's my maximal heart rate. So then if I times it by 0.80, 148. When I'm exercising, if you have a heart rate monitor, you want to get your heart rate up into a zone of about, if you're 35 years old, you want to get to about 148 beats per minute. So another easy way, if you don't have a heart rate monitor, is if you can just like barely carry on a conversation, then you're pretty darn close to your aerobic fitness range. If you can carry on a conversation with ease, then you're actually not working hard enough. So so that's where you want to like just barely be able to carry on a conversation, and that's a pretty good indication that you are working hard enough. And if you can do that, then you're going to start immediately achieving really awesome health benefits, and you will need me less. So I have like almost no incentive in sharing this with you, except that I'm a human being who cares about other human beings, and I just want to see you be your very best. So I hope that's helpful.